Talking now about helping women through all stages of life. Joining me now in this sponsored interview is Dr. Lauren Gimbel from University of Utah Health. We're talking perinatal mental health disorders. Welcome to the show.
Thanks so much for having me.
What are perinatal mental health disorders? I think they encompass a lot of different disorders.
Yeah, so perinatal is during pregnancy or after giving birth in the postpartum period for about a year postpartum after giving birth, and then any mental health condition that occurs during that time period.
How common are these?
Perinatal mood and anxiety disorders, which is depression and anxiety during pregnancy or postpartum, are very common. The most common complication of pregnancy, and they occur in about 20% in 1 in 5 birthing individuals.
Can you anticipate these? How do some women feel that way and some don't?
Yeah, that's a really great question. So people who have a history of mental health conditions are at higher risk, but otherwise you're right that sometimes it just occurs during pregnancy or postpartum without a history as well.
And we're not talking about baby blues. That's different?
Correct. So baby blues occurs in the first 2 weeks postpartum, and it occurs in up to 80% of individuals, but it doesn't last past that 2-week time period, and then it's also not normally affecting function.
So the important thing to know is that there are options, everybody, to help you feel better. We should talk about symptoms first. So someone experiencing this would be feeling what?
So people who have depression or anxiety can have a decreased mood, so they feel really depressed, really down. They have low interest. They have a change in their concentration or appetite. They're not sleeping well. They can feel really guilty, be really irritable or angry. They're just not really acting themselves or able to function as themselves, or they can have thoughts of hurting themselves or their baby.
And again, this can happen during pregnancy and then after pregnancy. You and I were saying during the commercial break, I'm so glad we're talking about it because the point is to destigmatize these feelings. You are not alone. So many women go through this.
Yes, 1 in 5. So
1 in 5.
Exactly like what you said, it's incredibly common. And the important part is talking to your provider about it. So your obstetrician or your family medicine provider or your midwife about it to see if you do indeed have it. And if so, to talk about treatment because we have some great treatment options.
Have women said to you before, I just feel like it's the happiest time of life, so I don't feel like I can say out loud that I'm struggling?
Yes. So some people do have a very happy time period, but that's not the case for everyone, and that's okay. And if you have those symptoms and have perinatal mood and anxiety disorders, that it's important to get treatment then, so you
and there
don't
is
feel
treatment.
that way.
That's the key, everybody. And what does that usually consist of?
Yeah, so there's conservative options, things like sleep, getting outside, healthy eating, as well as we have great therapy options, and therapy helps a lot. And then for some individuals, medications as well.
And again, everyone, if you're still feeling this months and months after and weeks after, that is very normal. I think that's probably the conversation you're having the most often. What you're feeling is normal.
Yeah, exactly. When it starts to affect function, though, and you're no longer functioning at work or in your relationships or in your day-to-day life, then it's probably time to talk with your provider about it.
So typically you go to that postpartum visit and they have you fill out a form. Mm-hmm. So you're saying answer it honestly.
Yes, that would be great.
Please don't say I'm just fine, which
Yes.
people unfortunately are doing because they don't want that stigma.
Yeah, and even if you don't score highly on the form or if you don't feel comfortable with it, really talking to your provider about any of the concerns of if you do have depression or anxiety, really because of the thing that we're talking about, which is that it's treatable.
Well, and often it doesn't go away on its own. What can happen if you don't get help?
Yeah, so untreated depression or anxiety during pregnancy is associated with negative outcomes. So you can have an early delivery, which is called preterm birth. You can have worse prenatal care, increased risk of substance use, difficulty with breastfeeding, or difficulty with bonding with the baby. But then also remember that it's really a family unit. So that postpartum as well, kind of the model of the family that you're building with your partner or on your own and for your baby or your other kids is really to try and treat medical conditions, with mental health being one of them.
I'm so glad we're talking about this now. I don't think we did even 21 years ago.
Yeah.
And now there's so many resources, everybody. If you would like to know more, please go to our website. You can also go to Postpartum Support International. Those websites on your screen. 801-585-1565 is a great phone number to call for resources. And as always, that National Suicide Prevention Lifeline, you can always call or text 988 for help. And our thanks to the U of U for this sponsored interview. We appreciate it.
Thank you.